I was told once I started working up here, look, Donald, don't become attached to the men. I said, how can I not become attached to them? Just do legal work for them. How can I just do legal work for them? And what I see in them is, I don't see a criminal. I don't see some man with leprosy or some sort of a disease. I see a human being who has not only been broken down inside his living organisms, his system, but a human being that has been broken down and cut off and ostracized by his keepers and everyone else crying out for help.
When you're talking to them, you know, you put yourself in a position and you try to find out, well, damn, how would I feel if I was in that position? You know, how could I deal with it?
AIDS is not like a cancer. You know, you can have cancer for 15, 20, 25 years. AIDS is knocking you out in a year.
These guys in here really, they're the closest I ever seen anybody up, you know, like being up close. This is like a new death row, you know, they used to have it down the hill, now it's up the hill on the 4th floor.
If a bull runs at you with his horns down, you're either to get out of the way or be gored. You know, and it's the same thing. They don't see the bull. The AIDS virus is a tiny, small, microscopic thing. But the bull is in front of them, and the bull is charging. Get out of the way. Grandma's getting it, little brother's getting it, politicians are getting it, movie stars are getting it. Everybody can get AIDS.
Carmelo, you got AIDS. You're gonna die 4 or 5 years.
I fell apart when they told me I had cancer, because I had gone through it with my mother.
One night while in the cell, after going to sick call that morning, I fell out. They rushed me out of the cell, took me to sick call, and there I had a high fever, I had a congested chest.
I was an inmate at Long Island Correctional, that's Pilgrim State, and while over there, I got the fatigue and the shortness of breath, but I didn't know what I had then, you know. I wasn't too much familiar with AIDS. AIDS was the last thing for my mind.
The doctor and I sat after I got my head together and even joked a little about it by saying, well, at least you don't have AIDS. That's something to be happy about.
I was told it was pneumonia, but not a type. I was then sent to Westchester County Hospital, and they informed me the type of pneumonia I have is an AIDS-related illness. And from there, everything went crazy.
As soon as they saw the x-rays, they were able to diagnose it as AIDS. And it took me a while to get used to it.
And then I'm told 2.5 years later that the cancer growth that they had taken out, the cancer, the biopsy, was AIDS.
I was then sent back to prison. Also, I knew it in the hospital at that time. I had you know, when they told me I had AIDS, I kind of foresaw what the type of treatment I was going to face when I returned back to the prison, and my thoughts were correct. Between the ostracization and isolation I met when I returned back to prison, finding out that now I'm an AIDS patient. But not only an AIDS patient, I'm compounded by being an AIDS patient by being an inmate.
I came right off the streets because I was out on bail. I went in January of '84, and I got sick on January of '85. You know, so I guess the AIDS virus was an incubation for, you know, perhaps maybe two years or maybe a year and a half prior to that. And it's bad, very bad.
I had one spot on my leg for over 2 years. one spot. And then, when I was re-diagnosed, they lowered the boom.
I'm trying to talk to a life and death issue, to an epidemic that I'm being told may be the most serious medical epidemic in recorded history.
AIDS is a syndrome that's believed to be caused by a virus, which is identified as HTLV3 virus.
In the first couple years that the syndrome was recognized, of course, there was practical panic among a lot of people because we didn't know what caused it. All kinds of theories. Well, it's from sniffing poppers, it's from injecting heroin, it's doing all kinds of things. And when you don't know what causes something, it makes it that much more frightening. Now we know.
The less fear that you have and the more knowledge you have, at least you're able to protect yourself and anyone else that you have as significant in your life.
Well, some people say as many as 1 million Americans may have this virus. So the virus is a lot more common than the disease AIDS or the AIDS-related complex.
There are, conservatively speaking, 400,000 people in New York City alone who are HTLV3 infected.
So far, the evidence is that not everyone who's infected with this virus will get AIDS. The best estimate that I've seen suggests about 20% of infected people will eventually come down with it.
In the adult population, the incubation period of AIDS is 3 to 5 years for those people who come down with full-blown AIDS. Not everybody does. Some people will go through life without ever coming down with full-blown AIDS.
But everyone who has been infected with the virus, and this is important for you to remember, is a potential carrier, can spread the virus to someone else. Even though he himself may not be sick, he himself may never get sick. As long as he's got the virus, he can spread it to someone else.
They may very well spread an infection that is 100% universally fatal.
The most common symptom in a carrier of this virus is nothing. Most people who have the virus will have no symptoms whatsoever. Okay? The symptoms that may develop first before frank AIDS comes on are prolonged fevers, and I don't just mean like the fever that you get with a cold or a flu that lasts a few days, maybe even a couple weeks, but then goes away. I mean a prolonged fever that keeps coming back, doesn't go away. Weight loss for some reason that you can't understand. You haven't been working out any harder, you haven't been skipping your meals, and you're losing weight. I would consider that a danger sign. The appearance of this yeast infection in the mouth, the appearance of swollen glands, big swollen glands in the neck. These sorts of things are part of the AIDS-related complex. That's not the same as AIDS, but people who have the complex are at higher risk of developing AIDS, and they should be under medical supervision. Doctors should be following them along. Many people will go straight from the asymptomatic state, straight from totally normal and healthy to deadly illness. And I'm sure you've heard of that, and possibly some inmates who were just fine, developed a severe form of pneumonia, and you never saw them again because they died in the hospital. That can happen as well.
They took him out here and took him to Westchester. And I think it was within 5 days, he was dead. He looked just as healthy as the average person. And it's devastating. This disease is devastating.
The bottom line you want to know is, oh, how can you catch this?
Do I know how I got? Yes, I got it through a drug use. I did get it.
And you don't catch it from food, you don't catch it from water, you don't catch it from casual contact with someone who's infected. Sitting next to somebody on the bus, shaking hands with somebody, you don't catch it that way.
Like I told you, I have no one to blame but myself. Ain't nobody gave it to me. I knew that I had read about it, and I knew that I was vulnerable to it, and I was chasing the bag, so it made me no difference.
It's transmitted by exchange of infected body fluids. And the big fluids are blood and semen. The most common ways this virus gets around in the population are through sexual intercourse and through sharing of needles that have been contaminated with blood. That's the long and the short of it.
I'd say I've met at least a dozen homosexuals with AIDS that feel they contracted it in jail while they were in jail.
What applies on one hand to the male homosexual applies equally well to the heterosexual, but nobody's talking to the heterosexual, or at least they haven't been up until just recently. And so, another group that we have to talk to is the heterosexual community.
Men can transmit this virus to women in regular heterosexual intercourse, and also, this is much less common, but it happens the other way around as well. A woman who is infected can transmit it to a man.
One of the things I think that's so important, education is so important. John had AIDS, and he was in a private room in the hospital. There was an officer outside, but there was a lot of privacy in the room. And his wife, you know, just wanted him to live. She wanted to do anything that would be pleasing to him because she loved him so very much, and she felt so helpless in being able to deal with that. And there was a time when, during a visit, John asked her to have sex with him, and she did. Knowing, I guess she wasn't as well informed as she could have been because there wasn't that much information available about AIDS in the beginning. But she herself contracted AIDS. And we were with the family the whole time. John was buried in March, and Tony went into the hospital in June, and Tony was buried in November.
There are really only 3% that can't think of how they got this virus, how they might have gotten AIDS. And I think if that 3% thought a little harder, they might be able to think of how they got it.
It's a jailhouse tattoo, it's a crew tattoo, and I believe that from the needles that were used, I contacted from this. I haven't had any homosexual experience. I haven't used drugs in over 7 years. And this is the only source I can feel that I've got this virus from.
If you interview these people very carefully, you'll find, for instance, a lot of the men who fall into this category frequently visited female prostitutes who, if they are drug addicts, have a good chance of having the virus, and they can transmit it to their male customers. Many of the other people, too, they were doing things that maybe in some situations is not good to admit that you were doing. Homosexual intercourse, shooting IV drugs. So there are very few cases of AIDS that we can't account for by people engaging in some high-risk activity or otherwise getting it in the blood.
You can have 1,000 contacts and get AIDS, and you can have 1 contact and get AIDS. They have not made that clear. No one's really certain how much exposure you need in order to have it.
Let me say something else here, too, because a lot of people, I think, are under the impression that if you are not a bona fide drug addict, or if you are not a card-carrying, dyed-in-the-wool homosexual, you will not catch this virus. The virus doesn't care what you are, okay? The virus is transmitted by what you do. So even if a couple times you've just for fun shot up some drugs, and on that needle that you used happened to be some blood from an infected patient, you can catch AIDS that way, okay? Same thing if you're not a homosexual, but you engage in sexual intercourse with a man who carries the virus, either inside the facility, someplace else, just a couple times, again, you're vulnerable, okay? And by the same token, these are the activities that have to be avoided if you don't want to catch the virus. So to put things in simplest terms, that's how you catch AIDS.
I'm not a devoutly religious man. Pray to God, you know, to give you some kind of strength where you can live your life without this narcotics, and pray to God that you never catch this AIDS, because Anyone who thinks prison was hell on earth don't know until they catch this AIDS.
I was the only AIDS patient at the hospital, so I didn't know what the AIDS itself was like. I came over here, and I was able to see the deterioration process, you know. It was amongst us, you know. I was able to see. I've seen 1, 2, 3, 1, 2, 3, 4, 5, about 6 deaths already. And it's really miserable, you know. It's a bad way to die. I mean, I would recommend that to my worst enemy. It's bad.
If you want a horror story, take a 180-pound man that drops down to 68 pounds because of AIDS, because of drug use.
I was weighing 168 pounds a week ago. 168 pounds. And now I'm back down to 151. That's in a week, you know. It's a lot of weight.
If you want a horror story, take a man whose body is eaten up by sores created by cancer. His legs and limbs swelling up 2 to 3 times their normal size. You know?
I weighed 220 pounds. As a matter of fact, my top weight was 238 pounds. I had 17-inch arms, a 32-inch waist. I was an ox. And being that I was so athletic, it was not fat. I carried no fat. I was solid. And when I came back from Westchester County Medical Center, I weighed about 140, 45 pounds. This all happened within 90 days. I didn't eat for 3 months. I had a tube down my nose. I was on an artificial respirator twice. I have 3 clinical deaths on my records now.
His illness is getting the best of him. He is not pleasant to look at, and he realizes that. And if any one of you would put yourself in a spot where someone would look at you and grimace, then you would start feeling some of the things that Daryl has. But Daryl's also a fighter. I've seen Daryl go down and come up, go down and come up. He's a fighter. I give him credit.
We attempt here to address the quality of life that's remaining. No one wants to lose hope. If they can maintain any level of wellness that they have here, if they start losing weight, we ask for the milkshakes and the eggnog and whatever, the visible seeing of yourself, at least maintaining weight or not losing weight and becoming thin gives them a certain amount of hope. I think it's very cruel to destroy anyone's hope. But we just deal with the quality of life remaining. We do not constantly address their death.
My family comes visit me frequently, you know, my family, my kids, you know, I get visits frequently. So they able to understand, and we spoke about certain matters concerning my death and stuff like that. So they were, well, they were able to put up with it just like I did, you know.
His mother, and I think this is all the families are the same way, are constantly hoping that tomorrow something new will be found. And I think that's something that we have to hold out hope for, that, you know, there might be a cure around the corner, and as long as there is life, we want to maintain the quality of that life and hope for whatever will enlarge their life and let them live longer.
I spoke to him about it. We all want him to come home. We're going to accept him just like when he left. The doors are going to be open. He's willing to stay with us. His kids are going to be around him, you know. They're probably waiting for him now to come home. You know? His son is learning how to talk and asking where's Daddy, and we're not going to lie. He's going to find out when he gets older. So we tell him Daddy's sick. Daddy wants to see you, but Daddy's sick. They need their family more than ever at a time like this. You know, especially when they know, and their family knows that there's only going to be a certain time between them. I figured in between that time, let them know how much you really love them and couldn't show it or didn't show it. But if the chance comes, let them know you do love them and you're going to be by them no matter what.
like my brother said, my family's rooting for me. You know, they'll always be on my side, and they'll be on my side, and they'll be on my side till I die. You know. So she's very affordable. I spoke with her, but it's still, you know, it still hurt her. She's still my mother. She bore me for 9 months. You know. I was one of the fittest up here, me and Bobby, you know. You know, people, they were saying that I was in remission, and, you know, I was actually believing it, you know, my hopes were up high. And all of a sudden now, bang, the pneumonia.
He has the basic thing about relapsing. That's all the thing which an AIDS patient has to fear, about relapsing and catching one of the infections that they had before, or getting multiple infections. I believe he's had relapsing into the PCP. He seemed to be a battler. He seemed to have what it takes to fight it, you know, but this whole thing is, the danger is not basically one infection, it's getting multiple infections.
I have a self-therapy with plants. You know, I take care of plants, and everybody that comes up here tells me that they're beautiful, and I like them. I like to keep them, you know. And one of the reasons I don't want to go to the hospital is because of that. Because if I go to the hospital, I'll be over there 3 weeks. I'll come back, they'll all be dead, you know. But I love them. I love the plants. So.
I don't know personally what strong point I can make to say, leave that dope alone. Unless, you know, you just constantly go in the room and you take pictures of somebody like Daryl and say, this is the consequence.
Oh, see what the day brings. So it's a Thursday afternoon.
Today's Thursday?
Yeah, today's Thursday.
Oh, yeah.
1985.
I lost a day somewhere.
Could you tell us something about Smokey? You mentioned him to me earlier.
Yes, well,
I mean, his place in your life right now.
he's an inmate, but he's a nurse's aide also. He works 16 hours a day here on the AIDS ward. I couldn't say enough nice things about him. I can't walk, as you know, because of my legs, so I can't take a shower. I have to bathe. I can't get out of the wheelchair into the bathtub on my own. So he literally lifts me up and puts me in the bathtub. He cleans my room for me. He helps me hygienically. And I think the most important thing is he's been such a support to me. You know, like if I was to say to Smokey, I'm through, I give up, I'm throwing in the towel. Which I've done many times. I've gotten very angry with myself. He gives me that little push that means everything in the world. Means everything in the world to me. And there's nothing he wouldn't do for anyone up here. Nothing. We just have to have enough consideration for him to make sure that he takes the precautions necessary. They were asking me if, did they think that my mother would consent to an interview? I said, sure, if I talk to her.
Why not?
You know?
At least,
She's gone through it.
right. She sees what's happening. She knows what's happening.
She held my hand while I was in ICU dying. You know, I mean,
You thought you was dying, not when you was dying.
I died. On paper.
On paper. As long as it's only on paper.
I think the happiest moment I ever had was when they took him off the respirator and told me, you know, that he was better. Then he went back on it again. And then when they took him off the second time, the doctor just couldn't believe, you know, that he was still here.
It's tearing her apart. It's tearing me apart. But right now, I'm not worried about me. You know what I mean? I'm more worried about her than I am myself.
I'm a very strong believer in God.
My mother had cancer also. Back in 1969. I've always been the mama's boy. I couldn't be bothered with none of the fishing, the football. I didn't want nothing to do with none of that, you know? So I've always had a special bond with my mom. And one second. I'd like to be able to make up for some of the time that's been wasted. I'd like to know she's happy. You know, because she works 6 days a week, sometimes 7. Her and my dad are split up, so it's like she's basically on her own. I know she has to keep up with her own problems, as well as keep up with me and mine. So I know how hard it is for everybody, you know?
I can only say that I love him. That's all. I'm in their poem.
I draw, I play practical jokes, I make a t-shirt, I call home and crack jokes with my children. You know, these are all sources of strength. You know, you draw inner strength, outer strength, you pick up a piece of paper and you draw strength from it. You know, it's just a matter of, it's easier to lay down and give up. The point that when I think about that I won't be able to hold my little baby girl in my arms no more, I'm not going to die because I want to do that. I want to see her married. I want her to see her grandchildren. I want to see the knucklehead who's her husband, you know? These are things that I have to live for. And to put anything in between that terminal illness, incarceration, would be to defeat the very cause of life, survival. I've had 23 spinal taps. I've been in intensive care, a respirator, lumbar puncture, rectal biopsies, oral biopsies, open lung biopsies, CBC lines placed in your jugular vein. I've had mild heart attacks, cryptococcal meningitis twice, and the pneumocystic pneumonia, PCP pneumonia. In each case, I've had single infections, but in each case, the infection got to a point where, you know, my recovery was doubtful. And I just don't accept that these things are going to kill me. You know how many of these beds have had 3, 4? You know, you don't relate any. You have to disassociate yourself. There must have been 3 deaths on a minimum, or on average, on every bed up here.
How can any individual, inmate, officer, hospital worker, family member, anyone protect themselves from getting the HTLV-3, the AIDS virus? The most important thing, of course, is not to engage in activities that spread the virus. And this is probably the most important point I can make.
Tattooing that goes on in the facilities. There should be a great deal. There's one needle that's being used that you do not have the autoclave or equipment or whatever that we have to sterilize these things.
The men that I have been in contact with, every one of them has been an intravenous drug user, using drugs for a number of years before they came in, but the most frightening part of that was, and I know in the case of Lenny and John and Kevin, the three of them shared needles in the prison and shared them with 4 or 5 other men in the prison. And that's frightening.
There are drugs in prison. There's a lot of homosexuality in prison. And the only thing I can really say is it has to cease. If it doesn't cease, the disease won't.
The reality of it is that there's an enormous amount of homosexuality inside the joint and outside the joint. They're not going to admit it to you. They're not going to admit it to most people, but it exists, and I've heard a lot of it, and it's real. And there are certain ways that you can avoid contacting AIDS even if you are homosexual, and those are the things that you should do.
You have to start somewhere. There's a beginning to everything and there's an end to everything. And until the high-risk groups that know that they're in the high-risk groups and don't have it, until they make a move, there's no moves to be made.
Now, I believe that all people who get AIDS are innocents until they're charged with knowledge. Once you're charged with knowledge, you have to be responsible. And so, at the end of seeing your tape, nobody is an innocent anymore, except the children. The children are the most innocent of the innocents because they had no choice as to who their parents were. They have no sexuality, whether it be homo or heterosexuality, and certainly they're not drug abusers. Their only problem was that they were born of a mother who was infected.
Many family members, many women go in to increase their families to conceive children on trailer visits. And in that case as well, it's absolutely essential that there be honesty between the husband and wife regarding any past sexual experiences or intravenous drug use, so that a child who might have AIDS is not conceived and born.
What are the responsibilities of the individual who's already been infected by this virus, who may have AIDS, or who may be one of that much greater number who just have the virus, got it from shooting IV drugs, from engaging in homosexual intercourse, something like that, but who doesn't have AIDS? What does that person have to keep in mind? Okay? Well, to avoid spreading the virus to someone else, first of all, that person should not be engaging in sexual intercourse with man or woman without special precautions.
When you've got an inmate who's doing a long period of time and the children are dependent upon that parent who's on the street, that's another reason that men have to be, and women, men and women have to be real honest about what they've been doing that might put the street parent at risk.
That person should really be thinking very seriously about having sexual intercourse with other people. That includes his wife, say an inmate who's discharged. Most doctors are not recommending complete abstention from sexual intercourse, but are recommending the use of the condom.
What more horrible situation than to have children with a father in prison and a mother who is dying of AIDS?
If people would observe these sort of rules, the transmission of this virus could probably be stopped immediately. That doesn't mean that cases of AIDS will stop occurring immediately, because many people have this virus that in years to come will go on to develop AIDS. But I think the time is now, at least, to start putting a rein in on the spread of this virus. And that's really within the power of everyone out there in the population, not so much within the power of doctors.
Like I said, I don't want to blame anything that's happening to me now on anybody. Because whatever path I chose, I chose. But I do have a lot of regrets. A lot of regrets. Because I could have made something of myself. I really could have. Unfortunately, it took me to get to this point, to learn. I'm hoping somebody can look at me and say, no. like I said before, I wouldn't want anybody to go through what I'm going through. I wouldn't want anybody's family to go through what I've put my family through. I wouldn't wish this on an animal.
I mean, he goes through constant pain. And one time I was going back there and he was talking, you know, he prays a lot. And he was saying, oh God, what am I going to do with my feet? You know, what am I going to do about my feet? You know, that's how much pain it was. And I think they were, gangrene was trying to set him or something.
Sometimes you're going to have to cry with it. Sometimes you're going to have to scream with it. Sometimes you're going to have to shit on the floor with it. Sometimes you're going to have to urinate all over yourself. Sometimes you're going to have a diaper on your ass from AIDS.
It's like serving 3 sentences for 1. You know, I mean, it's like double indemnity.
If AIDS ain't bad enough to make a guy leave them narcotics alone, then, like I say, then he just got to wait till Judgment Day and be damned.
All you have to do is reflect on your own past. Don't be honest with anybody else, and I'm not talking religion or anything. Be honest with yourself.
If you want to get high, then you have to go with what goes with it.
And please, in the name of God, the men, don't share needles and don't engage in homosexual activity. Your lives are at stake, the lives of your loved ones, and life is much too valuable and precious to be thrown away.
I'm gonna last for a while. I know it's not right around the corner, but it's close.
You're paying the greatest price any human being can pay, your life, if you don't listen to what people are saying about this age.
To all those friends that I still have out there, please don't catch this, man. Stay away from it.
You know, and you don't get it from a kiss on the cheek.
Please, man, don't go back to that needle, because, you know, it's bad. It's very bad.
Leave them drugs alone, you know? And I'm just as hard rock as anyone else in this penitentiary. 99 proof gangster. And I'm telling you, leave the drugs alone.
I just want to be able to be free before I die. I don't want to die in a prison. I don't.
I don't want you to die in prison either.
Man, wake up. Wake up before it's too late.